Hospitals across Ontario have started making cuts in the face of rising deficits, and they're asking for more from the province. Our Mark McAllister is taking a look at the industry's funding predicament. He joins us now from Queen's Park. So, Mark, I assume that there are serious concerns here about the strain on the healthcare system and then also what these cuts may mean for it.
Yes, at this point, Karen, the hospitals are saying that the cuts that are taking place are in fact lower risk, but they're as a result of a structural deficit of $1 billion at this point, and that is a number that could potentially rise in the years to come as a result of rising costs. Ahead of the spring budget, the OHA told the province that they need a multi-year funding plan. They actually need to meet full operating needs of the hospital sector over time. So that would add to about $2.7 billion. While they understand the financial challenges faced by the province as a result of the trade war with the U.S., for example, they say more can be done. This is as a result of the growing and aging population in Ontario and inflation, which means costs have been rising about 6% every year, and they're not getting the funding to back that up. Last year, the province asked hospitals to come up with a 3-year plan to balance their budgets based on a 2% annual funding increase. And right now, as a result, hospitals are dipping into their budgets that would be used for other things like medical equipment or needed refurbishments to the actual hospitals themselves, and that is being used to pay for operating expenses. So they're describing this as low-risk, cost-saving moves at this point, but I did have a chance to speak with the vice president of the OHA this morning. Here's what she had to say.
Hospitals have been working really hard to try to identify low-risk changes. So things like not filling existing vacant roles or looking at how to implement models of care, allowing kind of individuals to, work across different roles and functions. I think we're probably at the point where we've exhausted most of those opportunities and starting to now think about what tough choices we may need to make for the future.
For its part, the province is saying something different. They're saying that, or at least a spokesperson for the Health Minister, Sylvia Jones, saying that these changes are non-clinical, they're administrative, and do not impact patient needs at this point. Back to you.
Mark McAllister breaking that all down for us. Thanks so much for that, Mark.